Hi, you're watching India Post Live, India's first web TV news conversation online. I'm Shivraj, and today we're discussing how the Indian healthcare system is still biased against transgendered people. You can log into that conversation by logging on to indiapostlive.com. You can also tweet with us, hashtag IndiaPostLive, or use the handle @IndiaPostLive. Right, earlier this year, in April, India's apex court recognized transgendered as a third gender. Despite that, a private NGO in Kolkata has found that the Indian healthcare system is completely and absolutely biased against transgender people. They're calling it transphobia. Let's take a look.
Despite the new Supreme Court law ensuring them equal treatment, non-judgmental healthcare is still elusive for transgender people. This is according to an ongoing study by Civilian Welfare Foundation, a Kolkata-based NGO, on the medical problems faced by transgender people in urban areas and the healthcare they receive. Stress caused by the apprehensions of being treated unfairly, worries about abuse and humiliation, and administrative hurdles are preventing many of the country's 2 million transgender people from even seeking medical care. Sadly, many of those responsible for the transphobia are medical professionals themselves, who remain largely uninformed about gender identity issues. So where does this community turn to for something as basic as healthcare, and how long will it be before the pronounced discrimination stops?
So when will healthcare professionals get a little more sensitive to other sexual issues like transgender? Joining us in studio to discuss the issues, Kiran Ahuja from the NAS Foundation and Ashwin Mehra, who's also a linguist. But before that, we're also joined on the phone by Dimoy Debnath, who's the secretary at the Civilian Welfare Foundation, which is actually the organization in Kolkata that did that study. Devamoy, just throw a little more light on the details of your findings, given that the Supreme Court had actually made it very clear that access to healthcare is one of the primary rights that the third gender should enjoy.
Can you please repeat it once? Hello?
Yes, we just wanted to know in depth what your findings were, and can you give us instances of where you found very direct transphobia by healthcare professionals on the ground against transgender people when they went to them with their problems?
Yeah, actually here in Kolkata, there's a place where, many transgender people, they live there. So what we did was we tried to find out what they are actually suffering from in terms of basic healthcare, and we found out very weird and strange things. It's like there are many transgender individuals who didn't go to the nursing home or any healthcare center or hospitals probably for the last 5-7 years because they are afraid of the harassment and the insults they will face there by the general people who will be there as patients, and most importantly by the physicians, by the doctors, by the healthcare professionals out there. So they're really scared of going to the hospitals or nursing homes or any healthcare just because they will be harassed and they will be insulted, especially by the doctors and other healthcare professionals who are there present at the healthcare centers. So it's like we found out many incidents that many transgender individuals shared with us during our research process, and they were like they gave us some instances like a person who had an accident, and that person was taken to the hospital, and he was dead. He lost his life because the ward boys couldn't decide which ward he should get admitted, in a male ward or a female ward.
Absolutely.
So in that process, that person was dead, and he just lost his life because that ward boy didn't understand which ward that transgender individual should get admitted.
And Demoy, following on from a report, have you also had discussions with healthcare professionals, with doctors and paramedics on what the issue is? Are they even aware of the basics of the differences between transsexuals, transgendered, and other genders?
Yeah, they treat them differently. Obviously, I mean that is the main problem that is coming out, that we found out from the transgender individuals, that they were treated differently by the doctors, by the healthcare professionals, and they can see in front of their eyes that are so-called normal, straight or normative, which we call a patient who is a straight or a normative person. He's been treated differently, and in front of the transgender individual is treated like is not treated, is harassed and insulted. They are not even treated. Before the treatment only they've been harassed and they've been insulted, and that is why they don't go ahead with their treatments. So I'm not talking about any severe disease or any severe problem,
But just
then
basics.
I'm just talking about a basic healthcare.
Absolutely.
I mean, we have cold, we have cough, we have fever, we go to the doctor, we take medicines, but they don't even go for their basic healthcare thing, for example, fever or cold and cough.
And I read that apparently your report found that very often doctors wouldn't even check the pulse or touch the patient, given so much of a social stigma that they themselves
Exactly.
have.
I mean, exactly. They use slangs for them. It's like, why have you come here? You are not supposed to be here. If I have to use, I cannot use this language right now, but then they use very, very pathetic language with them. They don't even touch them. It's like it's a sin if they touch them. So we call the doctors as our life saviors, but then they probably they become I don't know what when it comes to the
Very
transgender
sad state of
individuals.
affairs. But thank you so much, Dimoy, for throwing light on that report and on those shocking findings there. Now, let's go across to Kiran. Kiran, you represent NAS Foundation, doing a lot of work on ground with transgendered people. What are the instances that you have found when they've gone to receive medical attention and the kind of reactions that they faced?
एक्चुअली हमारा नास में एक पर्टिकुलर जो ट्रांसजेंडर्स पीपल के लिए और एलजीबीटी कम्युनिटी के लिए क्लिनिक है जहाँ पे डॉक्टर्स उनका वीकली चेकअप होता है. तो वहाँ पे सो मेनी ट्रांसजेंडर्स आर कमिंग देयर. तो मैंने उनको एक दिन बोला कि कुछ बीमारी, छोटी मोटी बीमारी के लिए आए थे. मैंने बोला कि अगर आपको कोई माइनर या मेजर डिजीज़ होगा तो आप नज़दीकी हॉस्पिटल में जाके वहाँ से ट्रीटमेंट करा सकते. बट एक ट्रांसजेंडर थी, उसने मुझे बोला कि नहीं, हम डॉक्टर के पास नहीं जा सकते. मैंने बोला क्यों, डॉक्टर के पास जाने से आपको क्या प्रॉब्लम होती? मैं पहले भी जा चुकी हूँ, बट डॉक्टर ने मुझे बोला कि आपको क्या बीमारी हो सकती है, आप लोगों को क्यों बीमारी हो सकती है. मतलब एक तरह से उसका मजाक बनाया गया. तो उसके दिल में एक डिस्क्रिमिनेशन की जो भावना है वो थी, और उसने बोला कि इसलिए मैं नहीं जाती हूँ, वहाँ पे हमें मजाक के तौर पे देखा जाता है. तो आई थिंक क्योंकि ट्रांसजेंडर्स कम्युनिटी इकोनॉमिकली और फाइनेंशियली बहुत वीक होते हैं, तो उनके पास इतना पैसा नहीं होता कि वो अच्छी जगह जाकर इलाज कराए. इसीलिए वो एक गवर्नमेंट हॉस्पिटल में जाते हैं. अगर उन्हें बहुत होप के साथ वो लोग जाते हैं कि वहाँ पे, क्योंकि डॉक्टर एक ऐसे लेवल पे होते हैं, एक ऐसे पोजीशन पे होते हैं जहाँ पे हमारी कम्युनिटी के लोग उनसे खुलकर बात कर सकते हैं, और इस होप के साथ जाते हैं कि वहाँ उनका अच्छा ट्रीटमेंट हो.
तो यहाँ रिपोर्ट में भी कहा गया कि एक्चुअली लॉट ऑफ द केसेस आर ऑफ sheer stress of the abuse that they face, the shunning that they face, that causes them not to know where to turn, because even doctors are not helping them.
हाँ, तो डॉक्टर्स से भी उनको इस तरह की अगर बात सुनने को मिले, इस तरह डिस्क्रिमिनेशन सुनने को मिले, क्योंकि डॉक्टर्स जब डिग्री लेते हैं तो वो तरह तरह की मतलब डिग्री लेने से पहले वो कस्में खाते हैं कि हम हर इंसान को, चाहे वो ट्रांसजेंडर हो चाहे वो नॉर्मल पीपल, सबको एक नज़र से देखेंगे. पर अगर वहाँ भी उनको ट्रीटमेंट अच्छी तरह नहीं मिल पाए, तो आई थिंक ट्रांसजेंडर्स को हर जगह इस डिस्क्रिमिनेशन, इंसल्टिंग फेस करना पड़ता है. अगर डॉक्टर भी ऐसा करे जो कि हाई एजुकेटेड होते हैं, तो फिर आई थिंक ट्रांसजेंडर्स कि दिल में जो सोसाइटी के लिए एक हीन भावना है, वो हमेशा वो सभी को उस नज़र से देखते हैं.
Okay. Ashwin, have you ever faced any kind of transphobic comments when you've actually gone to address a health issue? What kind of reactions have you faced? Because you're out there, you're open about who you are and where you stand vis-a-vis your sexuality.
When I was transgender, there were a lot of difficulties that I had to face. Fortunately, I did not require any medical treatment from a public hospital because we have very good doctors in our own family. So I really do not want to be saying anything about how transgenders are treated in public hospitals. But yes, I talk about not just transgenders, but homosexuality, LGBT issues, queer issues with people from all strata of society. And believe you me, it gives me a very, very clear picture as to what kind of a treatment transgenders must be getting at public hospitals. And believe you me, the picture I get is very, very dire.
Okay. We're also joined on Google Hangout by Pallav Patakar, who's the director of the Humsafar Trust. Now, Humsafar has been doing a lot of support work for the community, but given the Supreme Court ruling in April, we're still actually quite a long way off before the third gender has actual access to public health.
But my belief is that the Supreme Court ruling in April only asked the government to set a path for better access. It does not, and we know very clearly from the public health perspective that having a ruling and actually implementing it are two different things. What it did ask the government agencies was to understand and be sensitive to the fact that there is a transgender community out there which does not have access to services, and that they would need to implement, or rather, first of all, formulate policies and then implement policies that access to various services, not just healthcare, but all government services are in place. Now, that would be right from getting bank accounts to getting your Aadhaar card to your election commission cards to all the government services which are enabling of the transgender community to go and access healthcare services. Having said that, I agree with Kiran in terms of the kind of problems transgenders face in the public health sector, but one of the things which we've noticed, and one of the things which is key, and mind you, it's not about public health versus private doctors. One of the issues that this country faces is that you could be an engineer, you could be a doctor, you've been graduate. It does not necessarily mean that your secular education is going to bring in sensitivity to issues which you're unaware about.
That was my next question.
It's not just
what are the kind of
don't expect them to understand.
Right. What are the kind of programs that exist or should exist that actually works on that sensitization of especially doctors? Because like Kiran was saying, doctors are folks that we look up to as the last port of call when there is an ailment. But if they turn you away and they scoff at you, it's very difficult.
Right. So one of the things that Humsafar does state is that you need to be in the public health system and make your presence felt. Because we realize that within the public health system itself, you have doctors who are graduating out of medical school without any idea about gender, sexuality, or sensitivity towards these issues. And they need to be actually brought into a classroom and to be told and expected to understand issues around gender sexuality. Now, all of them may not be, discriminating. It's just that they do not know how to treat that patient, or they do not know what the issues around that are. Many transgenders who come to us say that the doctor did not realize that I was hijra or transgender. They thought I was a woman and started prescribing to me as if I were a woman, and the doctor was totally flummoxed. Now, you have to understand that the doctor, within his cultural sensitivities, also may not be comfortable dealing with a transgender hijra individual, because these are issues which are swept under the carpet, and nowhere in the medical curriculum are these issues tackled.
Right.
So the key is education and sensitization, which we need to do.
Absolutely. And we'll just be coming back to you on more of those issues. But Demoy, I believe you're still on the line with us. The report that you came out with, the findings, are there any specific recommendations as to what programs can be implemented at the legislative and at the on-ground level to make a change?
See, it's India, and here to bring a change is like doing a really great and big job. So what we're trying to do is we are trying to set up a clinic which will be trans friendly and which will be free, because as everybody said that the trans community, they are not economically and financially very strong. So we're trying to set up a clinic which will be trans friendly, and where transgender individuals and everybody, especially the transgender individuals, can come and have their treatments for free. And the doctors and the medical staff, that those who will be there in the clinic, they will be obviously trans friendly, and here the trans community would not be facing the harassments and insults that they face in other health clinics and hospitals and nursing homes. So this is our first agenda, to set up a trans friendly clinic here in Kolkata. And secondly, I think workshops should be there for the healthcare professionals and for doctors and nurses and other healthcare staffs. So I think this way we can think of actually think of at least starting off a change here in India in terms of transgender individuals.
All right, thank you, Timur. Coming back to you, Pallav, we've had a few developments in the last few days where we've seen the health minister make a few statements. And in fact, if you've read the papers today, something really shocking where he says that sex education shouldn't be in the classroom. What are your reactions to that? Because that has a huge bearing on the discussion we're having right now.
Yeah, in fact, I was on the show yesterday at India Post, and this is exactly what I spoke about, and that children are sexually active or sexually mature far earlier today. And where I'm sitting right now, I sit just next to a testing clinic, and we are coming across in cases, field or even outside, where we are already seeing children who are sexually active at 12 and 13. Now, you can preach morality and you can preach Indian culture and Indian values, but don't do it at the cost of people losing their lives or getting infected. I do not wish to get into this dialogue of Indian culture, Indian value systems, because where I sit as a public health person with an intention of not judging or discriminating or attaching stigma to behaviors or to people's identities. And that's what the health ministry should be concerned about.
Absolutely.
I think at the matter of what Indian culture and Indian value systems are should be the Ministry of Culture, so I think there are some misplaced priorities as far as these statements go, and I feel that with the kind of HIV incidents and the toll that we have in our country, you cannot afford to be preachy, and
Absolutely.
You cannot afford to be
it is definitely a crisis we need to treat as a crisis and as a healthcare issue. Ashwin, I think just coming to you, because that was a statement that was splashed all over the newspaper today. Yesterday, the social media was a buzz. Pallav saying, I think we should keep culture and our biases out. But it has a huge bearing on how everyone views, health issues when it's on alternative sexuality issues as well.
Yes, indeed, it has a very negative effect if you take sex education out of schools, because that only gives children and society by and large the message that sex education is something bad and it has nothing to do with health. I was very shocked when I first heard that sex education was no longer a part of the school curriculum, and I think it should be an integral part, and people should know about all the issues that are associated with sex and sexuality and also gender.
Okay, and Kiran, this makes it very difficult then, because Pallav had a solution. He's saying we need to get a lot of people from the community to become part of the public health system. But if a government is saying something like take sex education out of the school classroom, it's a bit dangerous and it's a bit scary as well.
या ये जो इशू है, मतलब अगर कोई गवर्नमेंट की तरफ से ऐसे भाषण देता है या ऐसे बाइट मिलती है तो बहुत ही शॉकिंग होता है, क्योंकि जो सेक्स एजुकेशन है स्कूल में इम्पॉर्टेंट तो है ही, बट उसको कैसे किस तरीके से आप प्रेजेंट करते हो वो भी इम्पॉर्टेंट है बच्चों के एज को लेकर. प्लस ये भी देखना चाहिए कि जिस तरह की डिस्क्रिमिनेशन ट्रांसजेंडर पे और गे कम्युनिटी पे, LGBT कम्युनिटी पे हो रहा है, वो एक स्कूल से ही स्टार्ट हो जाता है। स्कूल में बुलिंग करना दूसरे बच्चों के द्वारा, और टीचर जो होते हैं, कुछ टीचर्स होते हैं जो होमोफोबिया हो सकते हैं और जिनको मतलब सेंसिटाइज करने की काफ़ी ज़रूरत है। और वो कभी कभी उस बच्चे को अगर उसमें थोड़ी बहुत बिहेवियर ऐसा हो गर्लिश टाइप, तो वो उसको अवॉइड करते हैं। तो आई थिंक स्कूल से ही हमें इस तरह की इश्यूज़ को लेकर बात करना बहुत ज़रूरी है और लोगों को सेंसिटाइज करना बहुत ज़रूरी, क्योंकि स्कूल से आगे जाकर वो एक कॉलेज लेवल पे जाते हैं और प्लस एक सोसाइटी में चेंज लाने के लिए हमें उस लेवल से बात करना इट्स वेरी इंपॉर्टेंट.
Okay, Pallav, it's very interesting. I met someone doing a PhD on how young Indians access information and education about sex. And a lot of the findings were that it's all from the internet and not from the classroom. So it is quite a dangerous trend, isn't there? Because there's a lot out there that's perhaps not authoritative, that's not validated by public health officials and practitioners like yourself.
So this is what our finding is, and what we are noticing is that when you are seeking information on the internet, you only seek information that you're looking for.
Right.
So you don't want to cut down the bitter pill, or the consequences of what you may not be following. And one of the disturbing trends which we are seeing in India is that, in fact, the awareness on the internet is far lesser, and people on the internet who would probably start accessing sexual partners on the internet don't feel themselves at risk, because there are assumptions that because of my social status and because of my knowledge, I'm not able to the risk of STDs, which is totally incorrect. I mean, all of us are at risk, irrespective of our social status. And if we are not aware of what that risk is, we are putting ourselves in great danger. And I think in fact, Humsafar is in the process of figuring out how do you access this young population, this youth, which is right now straight on the internet and out there, seeking information about sex, but is not willing to really go and seek the information about HIV and the risks and what they are supposed to do or not supposed to do. And some of the trends on the internet are really disturbing. And we are in fact in the process of doing a study which will understand what are the risks on the internet, so as to we can present these findings to the ministries and the government, so that they understand that just pushing things under the carpet under the garb of culture and sitting on these judgments about what's right, what's not, is not really going to solve the problem. 5 years down the line, you don't want people with more HIV infections because you chose to take a high moralistic ground somewhere.
Okay, we're just going to wrap up the show because we only have 5 minutes. Now, Ashwin, putting on your hat as an everyday person, what would you like to see change so that the findings of the report become redundant? The fact that transgender and third gendered and other gendered communities do not have basic access to healthcare.
Well, I would like, first of all, the healthcare specialists, the doctors and the nurses, to be true to their, vows, and to treat all citizens of our country equally. It does not matter if they are transgender, male or female or whatever gender. A human being is a human being, and we all have a right to the best health care that our country can offer. This is one thing.
Kiran, humane healthcare, do you think it's going to happen in the next few years? Because you are working on the ground, but do you see some change happening?
या चेंजेस आई थिंक बहुत ज़रूरी है, और चेंजेस लाने के लिए हमें हर लेवल पे जाकर लोगों को सेंसिटाइज करना पड़ेगा, चाहे वो स्कूल लेवल पे हो, मेडिकल लेवल पे हो, और पुलिस, हर जगह पे हमें लोगों को सेंसिटाइज और इस इश्यूज़ पे, LGBT इश्यूज़ पे बात करना, सेंसिटाइज करना बहुत ज़रूरी है, ताकि वो उनके राइट्स, उनके प्रॉब्लम्स को समझ सकें. और आई थिंक डॉक्टर्स तो ऑलरेडी एजुकेटेड होते हैं और उन्हें ऑलरेडी इन सब चीज़ों के बारे में इंफॉर्मेशन होता है. बट अगर डॉक्टर्स हमारे साथ अच्छा बिहेव करें तो हमें अच्छा लगता है, बट अगर हमारे साथ वो इस तरह की डिस्क्रिमिनेशन करे तो हमें बहुत बुरा लगता है कि डॉक्टर होकर वो हमारे साथ ऐसा करें.
So listening to all that you said, all that everyone said in studio, Pallav, just to wrap up the show, the 3 top line things that must happen going forward to change the current scenario.
I think one is within the purview of education and within the purview of the topic of sex education, gender sexuality needs to be immediately introduced. I think there could be parents' involvement and parents, consent, which could be taken in as far as this goes, so that parents don't feel left out into the scenario. Second is an immediate, gender sensitization and sexuality training, even as far as doctors, and maybe including it as a part of the medical curriculum, should be too. And third, which has always been something that we need to talk, is when you're talking about healthcare settings, you need to do away with stigma and discrimination, and that's the larger issue which Kiran is talking about. That if you continue to have stigma and discrimination in your healthcare setups, you're not going to have access to healthcare, and that's going to immediately affect your all your health parameters and all your health indicators. The moment you drive people away because of the judgments or the social judgments that you make on them.
Right, and I think that's really key, is working on the larger picture of ending social and other discrimination. Thank you very much, Pallav, for joining us there and giving us your perspective. Thank you so much, Kiran. Thank you so much, Ashwin. You can also continue having that conversation by logging on to Twitter, #IndiaPostLive. Keep the conversation going, and we will be continuing to respond and have more conversations.